A sick baby named Nick. Mrs. Eileen Wick was sweeping with a broom while her baby boy Nick was still in his room. She knocked on the door to hear only a cough. She opened the door and knew something was off. The little baby Nick lay in his crib very sick. "What's a mom to do?" asked Mrs. Wick. She first tried Dr. Deeks, who said, "We don't have an appointment for at least 1 full week." She then thought of Dr. Bolands, but then remembered his office was not open on weekends. She called yet another doctor on the phone, but Dr. Khan said they were out of his zone. All she wants is help for her little baby boy Nick, but the doctors can't help and he is still sick. Still, she continued and tried Dr. Brands, only to learn she wasn't accepting new patients. Mrs. Wick was growing very frustrated. A new process surely needs to be created. She got on the phone with Miss Shirley Baker, who happened to be a policymaker. She talked to Miss Baker about all the doctors and all the sick sons and all the sick daughters. Miss Baker needed to know a couple of things to proceed, like who are these parents and what do they need. If only someone had gathered this information, we could get all babies everywhere proper medication. And then, as if perfectly timed, in came an email with a computer chime. Characteristics of mothers who have difficulties getting healthcare for their infant. What a great difference this research will make for all those parents with children who ache. Doctors can now open their doors to all the parents who need help more. Little baby Nick lost all of his pain, and Mrs. Wick would never have to worry again. The end.
Hi everyone, my name is Elisa and this video is about my research which aims to determine which Canadian mothers find it difficult to get healthcare for their infants. As Canadians, we're usually very proud of our healthcare system. We believe that whether someone is elderly or an infant, has money or doesn't, lives in a big city like Toronto or a small rural community, we all deserve the best healthcare whenever we get sick. Unfortunately, this isn't the case for Canadian infants. 13.1% of Canadian mothers report finding it difficult to get healthcare for their infant. Currently, we don't have a lot of information on the mothers who find it difficult to get healthcare for their infants. For example, the majority of them might be rural mothers who find it difficult to get healthcare because of a doctor shortage in rural areas. Or the majority of them might be first-time mothers who find it difficult because they don't know how to navigate the healthcare system for an infant. Without knowing this information, it's impossible for government officials and policymakers to create programs that will improve healthcare access for infants. My research will fix this by determining which Canadian mothers find it difficult to get healthcare for their infants. This will allow targeted programs for infants who have poor healthcare access to be created. For example, if rural infants have poor healthcare access, then greater incentives can be put in place for physicians to practice in rural areas. If infants of first-time mothers have poor healthcare access, then the healthcare system can be made easier to navigate. In conclusion, my research will determine which Canadian infants have poor healthcare access and will allow for greater healthcare access for infants to be established. Thank you.